morning, everyone. Mental health challenges are being talked about more frequently with every passing day. We can see that the world is changing and people are more receptive of mental health challenges. Patients are finding more acceptance in the society. However, there are still many myths about mental health that are widely prevalent even today. We have with us today Dr. Himanshu Desai, a senior psychiatrist from Ahmedabad, to break these taboos and break these myths about mental health in the current world. Welcome, doctor.
Namaskar.
So, sir, getting right into it, the first myth that I have seen many people actually say that it does not happen to everyone and mental health problems are uncommon. How true is that?
Actually, if you see that mental problems are very common. Suppose if you count different mental health issues, then it will reach to more than 40 to 50% of population are suffering from some or other kind of mental issues. Let me give you the counting basically. 1 to 2% people are suffering from schizophrenia. 15% of the population, they have depression in their life some or other time in their life. So 15 plus 2 is 17. 5 to 7% are having anxiety disorder. 3 to 5% are having bipolar disorder, manic episode. Then 15 to 20% of population are having sleep related problems. Then addiction is very common. Around 20 to 30 or more than that population is having problem related to addiction. Then there's a whole bunch of issues related to child psychiatry. So if you make total of all these things, then it will go beyond 40 to 50% of the population. So अगर 100 बंदों को आप लाइन में खड़े कर दिए, तो उसमें से 40 लोगों को you will find that they are suffering from some or other kind of psychiatric illness. So it is so common, but somehow there is a stigma related to mental health, stigma related to word psychiatry. So they would not like to go to a psychiatrist. They would hide themselves going to a psychiatrist. But truly, when they are going to some different specialties like gastroenterologist or neurologist or any other pathies, but they will prescribe some or another medicines related to mental health. So definitely they find some element of mental health in their all other diseases. So whenever you see a prescription containing any antidepressant in any prescription, means the person is having some issue related to mental health. But we are not ready to accept that I am suffering from some mental illness and I need to see a psychiatrist. There is a stigma, there is a taboo, and people avoid going to a psychiatrist.
Absolutely, sir. Very well said, sir. As you said, the statistic itself says that 50%, at least 50% of the population suffer from some kind of disease. And we still believe that it's very uncommon and it does not happen to me or it will not happen to my family, which is so untrue. Very closed ones, your closed ones might also be suffering from it. You just don't know about it. So it's not at all that it is uncommon. It's very common and it's okay to have it. And there are psychiatrists that you can consult. So moving on to the next myth that people with mental health conditions cannot lead a normal life.
Look, when you will come to our clinic, you will find that there are plenty of people sitting in our visiting chairs like any other hospital. Person with mental illness can very well live very much normal life. Only schizophrenic patients or some other disease, whenever there is a bouts, there is an episode, they have some abnormality in their behavior. Otherwise, all neurotic patients, all depressive patients, all anxiety patients, they are living as normal life as you and me are. Sometimes it's very difficult to judge that he or she might be taking some pills or she might be seeing a psychiatrist. It's very difficult to pick up also. So it is very much common to live a normal human life, even with taking psychiatric illness, even with taking psychiatric medications or seeing a psychiatrist or psychologist.
Absolutely. It's just like a physical ailment. Even if you're suffering from something like diarrhea, you can live a normal life. It's as
absolutely. Absolutely.
Very well said, sir. That brings us to the third myth that people generally feel that if someone has friends, they don't need a therapist. And you only see a therapist when you're lonely or you don't have someone to talk to. How true is that?
This is not true. Because a friend is a friend. They have their own bias. when you are meeting a therapist who is a neutral person and he or she is not interested more than your therapeutic improvement, so their interest is there is a gap between you and them. So there's a boundary. So they'll not cross the boundary. They'll not allow you to cross the boundary. So it's a therapeutic relationship. So therapists, and they are expert in their work. So friends cannot be a therapist, and therapist cannot be a friend. So friends, though you have a good number of friends, and even though they are psychiatrists or psychologists, but being a friend, there is a limitations. So you need to go a professional who is a neutral person. They have a helicopter view or bird view about your situation. So they'll help you in much better way, much scientific way in your problems.
Exactly, sir. And friends, after all, they're friends. They'll want the best for you, but they're not professionals. Therapists,
True.
even if it means something, taking a difficult step, they will take that because they're professionals. So it's important to remember that friendship and therapy do not go hand in hand. Your friend cannot be a therapist, and it's okay to consult a therapist. Sir, there is this one common myth that only people of older generation suffer from mental health challenges, and children can't suffer from that.
Look, the problem of psychological issues can start very early age.
Mhm.
From 1 to 2 years of child might start having some problem. Even we can see depression and OCD, obsessive compulsive disorder, is again very common at your age of 4 years, 5 years, 7 years. It's very common.
Mhm.
Children suffering from mental illness is very common. ADHD, there are huge number of cases you will find of ADHD. So
Mhm.
so there is a problem with the school, problem with many other issues. So school and child psychiatric is again a upcoming branch in India. There are very few child psychiatrists, as the mental health professionals are very in less numbers. So child psychiatrists are in very less numbers. But as the day passes, you'll see more and more child psychiatrists in India also. Right
Mhm.
now, many neurologists, they work as a person who is working with children only, but they are basically neurologists. But it's a field of psychiatrists, and more child psychiatrists are coming up, and you will see that they will get full work, because there are plenty of people who need help for their children.
True, and sometimes we believe that our children are just throwing tantrums and they're just being kids, but actually that might be a cry for help, and they might be suffering through something. So it's not okay to believe that children can't suffer from these mental health challenges. As you said, ADHD and OCDs can have symptoms in early stages of childhood also.
Right.
Sir, next question is, which I think is very common, especially when you talk to your parents or when you talk to your teachers, that mental health problems are not actually problems, and you can just snap out of it. It's not a medical condition. It's just something in your mind.
Uh, there are people who will say that you should be of having strong mind, and you should remove
Exactly.
all the thoughts in your mind. And how can you have a problem regarding to mental health or regarding to thoughts? Thoughts should be in your control. I'll ask
Exactly.
all of them. Just close your eyes and don't think of black cat. काली बिल्ली के बारे में आपको सोचना नहीं है. If you can do it, then maybe you are next to God. But if you cannot do it, then you are a human being. The production of thought is a constant process. Everyone, full day, they are having more than crores of thoughts. So thoughts is a regular process. It comes to everyone's mind. It comes and it goes away. It comes and it goes away. It's a normal natural process. But these people, they are having sometimes thoughts regarding to sadness, thoughts regarding to cleanliness, and they cannot come out of these thoughts. And it's not under your control. Why saints are going to Himalayas and they sit and do malas and everything to make their mind in calm position. So for a normal human being, to control a mind, it's not in their hand. So, and again, mental illness is not, it cannot occur to only a person with having strong mind or maybe low mind. No, it can occur to anyone.
Anyone.
It has no bars. It can occur to an IT professional. It can occur to a shepherd. It can occur to a woman. It can occur to a man. It can occur to a child. There is no cross. There is no bars. It can occur to USA. It can occur to Antarctica. It can occur to any part of India also. So there is no geographical bars also. So mental illness is as common as diabetes, blood pressure, thyroid, like any other illness. So it is so common illness like any other illness. So it's not in your hand. किसी के हाथ में नहीं है.
Exactly. आप किसी को ये थोड़ी कह सकते हो कि डायबिटीज तो बस तुम सोच रहे हो डायबिटीज खत्म कर दो. It does not work like that. It's also an illness and we need to be sensitive towards it. And sir, this brings us to my last myth, which is very related to the medicines and medicines that we have for all of these mental health challenges. That people generally believe that they're addictive and they are just sleeping pills. What are I'm sure these are myths about medicines.
Modern treatment for mental illness are quite modern, and there is lots of research are going. Mm-hmm. There are some pills which we are using can be sleeping pills, and which are the need of the patient, and that is why they are given. They are not the addictive pills basically. Mm-hmm. Whenever people are coming to us, they want to just leave these medicines. They are not ready to take the medicines for mental health for long, but at the same time they are not ready to give up their medicines for hypertension, their medicine for diabetes. हम लोग उनको ये बोलते हैं कि आप diabetes, blood pressure वाली छोड़ दो. These are not addictive. No, they will say that no, these are the need of my body. Similarly, there is chemical locha in your brain, and for to recover that chemical locha, you need to give this medicines for mental health. So mental health medicines are like all other medications, like diabetes, the medicines for diabetes. It resolves this chemical locha in your brain and it helps you to recover from your problems. So these are not addictive medicines. These are the need of your body, and that is why we are giving it for a longer time, for a little longer time, and sometimes for lifetime also. But they are not addictive. They are the need of your body. There are some chemical, they are not secreted properly in your brain, and that is why we have to give them from outside. It's like diabetes, it's like hypertension. So these are not addictive medicines, and so people, they have to take it for the time that their doctors are saying. So they have to take it religiously. Please don't stop your medicines. If someone says that this is, talk to your doctors. Don't stop the medications.
Exactly. I think that's a very valid point, that talk to your doctor. All of these myths, they are they can be easily found on the internet. When you're reading a lot of content, you will find one of the two myths. But it's very important to talk to your doctor, trust your doctor, because they are after all the professionals and they'll help you understand your situation better and what is the best step forward. Thank you, Dr. Himanshu, for joining us today. This has been extremely helpful. And I'm sure many of us actually understood what are these myths and what are the actual facts behind it. And we will be a little bit more wiser when it comes to mental health. Thank you, Dr. Himanshu.
Thank you. Thank you.